Hi, it's Dr. Matt Harkness with Allied Physical Therapy Wellness Community, where our mission is to get you back to what you love without surgery and without medication. Well, here I am in the kitchen, my most favorite room, either at home or in the office. I enjoy cooking. I love the smell of fresh food, cookies. We serve some cookies here. They smell wonderful. And it's a great place to meet and gather and create memories together. Well, according to the CDC, 1 in 5 falls result in injury. And yes, a lot of falls could potentially happen in your kitchen. Over 3 million visits to the ER are a result of a fall with an injury. And of those 3,800,000 will be admitted into the hospital. And the most severe injuries are either a head injury, traumatic brain injury, or a hip injury or a hip fracture. Both can be devastating to your well-being and health. So let's consider the risk factors for falls. 1, if you're over 60, you have an increased risk for falling. 2, if you have some chronic dizziness that you haven't seen the doctor about, that could also increase your risk for falls. Important footwear is critical. If you don't have good footwear, good stability, or if you have a loose garment that you could trip over easily. Low lit areas or tripping hazards such as doggy toys or something that has fallen on the floor during cooking and you trip over that. So let's consider what to look for in a loved one or even yourself that you could potentially be one of these statistics. So 1 is if you're apprehensive with movement. You could be looking down as you initiate movement a lot. You're not confident looking ahead. Or maybe you're grabbing onto furniture without even thinking about it, but you're always grabbing for the counter, grabbing for a wall, holding onto the refrigerator as you're walking around the kitchen. So let's consider some common things that could be a risk factor in your kitchen that if you don't take care of or not aware of could be a potential hazard. So 1 would be loose items on the floor. You're putting away groceries, you leave a bag of groceries on the floor and not paying attention, you could trip over it. Or it could be something wet and you're washing the dishes, it splashes out of the sink onto the floor and you don't immediately wipe it up, it could become a surface that you could slip on. Or perhaps you have a rug that is not anti-skid or is really thick and you could easily trip on that. That could be a hazard as well. Another hazard is trying to reach high up in the cupboard and really extend your body beyond what your balance can handle. So in that case, you would probably want to use a secure step stool. Make sure that it's stable, and then you can put that heavier item away safely. Also, it is important that you keep things handy like a dry mop that you can quickly grab and it has a surface kind of like a terry cloth that you can easily wipe up a light spill, or if it's something more major, you have a regular standard mop that would help that you could wipe up that object, that water with. So be sure to keep your kitchen clear of clutter. Keep it well lit. If you have to get up at night and you want to go into the kitchen and you need a drink or something, just make sure you turn on the lights and it is bright and you can see clearly. So let's talk about 2 of my favorite balance exercises that you can do as a habit. And the first exercise is to challenge your balance by crossing your arms at your chest and bringing your feet close together. And then just see how long you can balance there. I would start with maybe 15 to 30 seconds and working up to a minute. Then to make that more challenging, you can do a slightly staggered stance. Same thing, 15 to 30 seconds. And then you can increase the staggered stance even more and bring in your feet narrower, and that will be the most challenging position. So that's a great one to do. Perhaps in the morning when you're brushing your teeth, take a few minutes and do that balance exercise. The second one that is really good is helping you to be better at initiating movement. A lot of times when you fall, you are in the beginning stages of movement, just initiating a step, and you misstep and it results in a fall. So this exercise, I like to place my hands or your hands on your hips and just initiate with one of your legs, like you're going to take a step, and then come back. Step and come back. Step and come back. And then do it with the other side. Step and come back, and so forth. Then do it behind. You can step backward and back 3 times, and then the other side 3 times. So it's important with both of these is to generate habits and routines where you practice your balance exercises. Well, be sure to visit our website, alliedpt.com. We have some great books in there. We have some videos that are very helpful, and a lot of great resources there for you. And remember, prevention is much better than getting a catastrophic injury. So if you or your loved ones have any of these risk factors, do not hesitate. Give us a call. We want to work with you, get you confident in doing the things that you love. Well, thank you for joining us, and we will see you on our next Wellness Connection series. And thank you for being part of our community.